to the 10th Annual Art for Health Benefit. Thank you for joining. We are Creole Roots, and we are excited to be a part of this virtual event.
Si la conscience est à chanter, c'est pour l'humanité chanter. Côté l'humain prend la voix et en tourbillon qui l'élève. Manger qui est par mission danser. Et pour ça, c'est longtemps qui s'en fait. Si vous faites la voyelle, ou pas ça pour habillé tout en blanc, pour la monter au palais. Papa et des belles garçons, et les beaux belles garçons, habillé tout en blanc, pour la monter au palais. Elle habillé tout en blanc, ils semblaient en débuter. Elle habillé tout en blanc, ils semblaient en s'énerver. Elle habillé tout en blanc, ils semblaient en débuter. Elle habillé tout en noir. Monter au palais, attaquer les belles garçons, c'était les beaux belles garçons, habillés tout en blanc, pour la monter au palais. Elle habillée tout en blanc, ils semblaient en débuter. Elle habillée tout en noir, ils semblaient chez la terre. Elle habillée tout en blanc, ils semblaient en débuter. Elle habillée
much, and don't forget to donate.
Hey everybody, it's Chloe Bennett here. First off, shout out to the Creole Roots. Thank you so much. That was amazing. Thank you for opening our night. Welcome to the annual Art for Health benefit. Woo! Very exciting, very awkward because there's no one here to clap. So I'll do it right here. Tonight on 10/10, we are celebrating 10 years by taking you into two of our partner communities, Villa Verde and Dominican Republic, and Jerusalem, Haiti. We will also take you inside one of our orthopedic surgical trips. While COVID has obviously affected us all, the socioeconomic fallout in low-income countries has resulted in even further devastation. So this year, more than ever, we have relied on the dedication and strength of our community leaders and our medical personnel. To name a few things that we have been doing, the clinic in Peralta, which is now fully independent, is the only COVID-19 testing location in the community. It is the only one for the community and for its neighbors. In Villa Verde, the community leaders have been delivering much needed supplies to the most vulnerable, and our recent team worked with the leaders and provided care and medications with home visits and to patients with chronic diseases. So, excuse me, I'm reading off of a teleprompter because COVID times, very unofficial, but hopefully you guys bear with me. In Jerusalem, our Haitian medical staff have resumed treating patients. They wear full PPE in crazy hot weather, and they are doing everything they can to assure safety and make sure that the community trusts them. You guys, our ability to continue supporting the local teams was only made possible through donations and through people like you watching tonight. Without you guys, this is over. So we need you now more than ever. And without your ongoing support, these difficult times are impossible. So please, please, if you can, donate to the link. I think it's below. It'd be weird if it was anywhere else, but I think it's below. This is me hosting and kicking off the night. I'm going to pass the mic over to Omar, CEO of Rush University. And again, thank you guys so much for being here. We're so excited. And donate. Omar, off to you, bro.
Thank you, Chloe, for your introduction. And I'd like to echo your thanks for the medical leaders and local leaders that not only made this event possible, but the incredible work possible. Who would have thought that this started just 10 years ago? And what started 10 years ago, the Art for Health benefit, was an engine that was a machine for some amazing accomplishments. I'd like to highlight just a few of those accomplishments. The Peralta Clinic in the Dominican Republic is now a self-sustaining clinic offering state-of-the-art care for a needed community. Not only is it offering state-of-the-art care, it became the model for Villa Verde, another clinic in conjunction with the Ministry of Health of the Dominican Republic, which will provide self-sustaining care for the future. The Jerusalem Clinic, a clinic fully staffed now by Haitian volunteers, will continue to provide care for a displaced community. Surgical teams have provided over 2,000 much-needed surgeries that otherwise would not have been able to be done. One issue is just providing care. Another is providing ongoing education. 4 to 5 conferences are made a year for continuous medical education for the volunteers and people involved in these programs to make sure that the care that's being provided is second to none. Hundreds of Rush students and faculty have had a life-changing experience by going down and having an opportunity to serve a population that needs help. To our alumni, the students, medical trainees, physicians, pharmacists, PAs, nurses, dentists, thank you for your incredible work, for your donation of time, and for the effort that you put behind a project that really is life-changing for so many people. Without you, none of this would have been possible. Now, I'd like to take a second to show a sneak peek of a video that highlights the work of our orthopedic team just this past February. Afterwards, stay tuned, enjoy the rest of the program, and I'd like to thank you again for your continued support.
getting surgery in the Dominican Republic is very challenging. We have a number of great surgical colleagues with whom we collaborate. However, the system is very broken.
The government is supposed to invest 4.0% of the national income towards health. What happens is, historically, government is investing only 1.9%. Means that they don't have the budget that they need in order to take care the basic needs of the patients.
Patient wanting to get surgery here who doesn't have insurance has any number of barriers. They are obligated to pay for all the equipment they need for surgery. They'll be obligated to pay for surgical care itself, how many hospital stays are charged for, and this really is out of the range for most patients who live on, a few dollars a day.
Cuando tienen un accidente, no solamente piensan en que tienen una fractura y no van a poder comprar unos materiales para hacerse una cirugía y estar bien. Van a pensar todo el tiempo que no tienen para mantener la familia o que están pagando la moto porque la toman a crédito en una casa financiera y eso es letal para la familia. Entonces, cuando ellos ven que está un grupo, es su esperanza.
It was an immediate addiction that we had the resources, we were there, we were able to help the people, and it brought an immense amount of satisfaction being able to do simple things like straighten out a bent leg or take out a plate or something that we know how to do very well here in the States, but they just don't have a way of doing that there.
Me frenó adelante en el motor y yo no tuve el control. Me operaron del fémur y falseé y la placa se me dobló. Vine aquí, me tiré una placa, no había doctor ese día para atenderme y llegando a mi casa falseé de nuevo y la placa se me rompió.
Right now has been working with Regional Hospital Taiwan and the Regional Hospital of San Juan. Both are covering two of the most poorest areas in the Dominican Republic.
Community Empowerment nos brinda su apoyo al hacer estos tipos de operativos quirúrgicos en los cuales nos dona esos materiales que necesitan para intervenir esos pacientes.
It has been an amazing experience. There's been a very, very, very steep learning curve with it. Understanding what we need, understanding what makes up a good team. At first it was, let's just go and help people. And then as time has gone on, what that help means has definitely changed.
Debe haber un lazo de amistad entre las personas que integran ambas instituciones. Lo segundo, mantener una comunicación constante, no solo como instituciones, sino también de lazos y amistades.
Yo venía para acá, para el hospital, que tenía dolores de parto, y venía con mi papá y mi hermana. Una guagua, pues, se nos atravesó y nos chocó. Se me fracturó la pierna allá y el brazo. Mi bebé está bien, gracias a Dios. Sí, ella nació el 26 de enero y su nombre es Ashley. Lo que más quiero es, claro, estar con mi hija, ver a mi hija y poder atenderla.
Patients go back to very challenging environments where often there's no running water, so how do you keep a wound clean, for instance? Maybe they lose their crutches, can't afford to buy another set of crutches, so now they're going to walk on their fresh leg surgery, which they really aren't supposed to be walking on. So there are many, many challenges that these patients face.
Porque tuve el yeso, nunca pude trabajar. Todo el tiempo estaba sentado o acostado en una cama. todo normal, me sentí normal, hago ejercicio, voy al gimnasio, normal, trabajo, todo normal.
Sustainability in surgery is very challenging. We have partnered with a pharmaceutical company here. They have a philanthropic branch of their organization to provide continuing education in various subspecialties, including surgical subspecialties. And that's actually been a very effective way of bringing state-of-the-art knowledge and even technology to the surgical academic groups in this country. And that's something that's been really exciting for us.
Our translators are residents, Dominican residents, and Dominican doctors, which are taking advantage of this platform in order to get training. And that interchange has been very enriching.
Nosotros celebramos cuando terminamos una jornada de ortopedia que dejamos todas las salas vacías, limpio el hospital, sin paciente con fractura. Pero también cuando regreso 15 días después al hospital y encuentro ya muchos pacientes, se comienzan a preguntarme cuándo vuelven.
Hi everyone. Wow, it was great to get to learn about surgery in the DR and get to meet some of the patients, so thank you for that. For those of you who don't know me, I am Jess Vlamming and I will be your co-host for this evening. I am a PA at Rush. I've been working with community empowerment for the last 7 years, and I volunteered on 7 primary care trips to Haiti and the DR. And actually in just a couple of weeks, we'll be going on our next trip to Villa Verde. What I love about community empowerment is that it works with local leadership in underserved communities to provide essential healthcare in Haiti and the DR. But at the same time, it promotes the development of self-sustaining healthcare systems. Our model is based on partnership with community leadership, other NGOs, academic medical centers such as Rush, and governmental agencies. And the communities that we work with, they really don't have any other access to primary care services. Working with Rush medical personnel, we provide medical care for over 6,000 patients and perform over 380 surgeries a year. And in our wake, we leave permanent healthcare clinics. I've seen firsthand the positive impacts that these trips have had on the communities and on the individual patients. But also the invaluable learning opportunities for our interprofessional teams of medical staff, students, and residents. And for this next generation of medical providers, there really is no better classroom. And here we are tonight at the 10th annual Art for Health event, super exciting. Art for Health, in case you are wondering, is a result of a unique collaboration between artists and medical providers. Artists have been accompanying us on our trips for over 10 years, and it's really through their art that we're able to tell the stories of the communities where we work. And now more than ever, our partner communities need our support, which means we need yours. Thank you to all of the donors who are contributing right now. We see you, and we really, really appreciate you. As a reminder, there is a link below to donate, so click the link. It will take you to the CE website where you can donate directly. But guys, it's Saturday night, so let's check back in with Creole Roots. Many of you might remember them from previous years. They are a Haitian band and they are always a good time. And since we're all at home, now everyone can dance like there's actually nobody watching. Thank you.
permanently discredited and abandoned. Everywhere is wrong. So until there's no longer first class and second class citizens of any nation, I've got to say until the color of a man's skin is of no more significance than the color of his eyes, I've got to say until that day, the dream of lasting peace, world citizenship, full of international morality, will remain in but a fleeting illusion to be pursued, but never again. Now everywhere is war. It's a war in the east, war in the west, war up north, war down south. This is a war, rumors of a war. This is a war, rumors of the war. Until the ignoble and unhappy regime that goes on with others in Angola, in Chicago, Minneapolis, I'm being supported, but I will destroy everywhere in war. War in the east, war in the west, war up north, war down south. It's a war, wars of the war. It's a war, rumors of war. War some die, war some lose it, some win it, some crying, some singing. We don't need no more trouble. We don't need no more trouble, no more trouble. What we need is love, Lord, to guide and protect us on. If you all look down from above, help the weak if you are strong now. We don't need no trouble. What we need is love. We don't need no more trouble, no more trouble, no more trouble. Yeah. We don't need get dogs down. Yeah. No more trouble, no more trouble, no more trouble. Speak happiness, sad enough without your vote. Come on and speak of love, sad enough without your vote. We don't need no trouble. What we need is love. We don't need. Thank you.
Thank you so much.
Thank you, Creole Roots. Now we're going to take you to our newest partner community, Villa Verde. Villa Verde is located just outside of Santo Domingo in the Dominican Republic. Since we began our work there in late 2018, our primary care teams have been able to see 4,036 medical patients and 115 dentistry patients. They've performed 693 hearing screenings, and we recently launched a new diabetes screening program and are using point-of-care testing to screen patients at risk for diabetes. Plus, we are working with the community to construct the first ever health clinic in Villa Verde. This would be recognized by the Dominican Ministry of Health and would provide access to essential primary care services all the time for the community. Did you know that $1,000 will cover the training of 2 community health workers in Villa Verde? The healthcare workers are people from the community who undergo training in basic first aid, wound care, hygiene, nutrition, diabetes education, and so much more. They are an integral link between the community and the healthcare workers. We know you're getting a lot of asks these days, but we hope you can see just how far your dollar goes with community empowerment. And as a reminder, the link is below.
Hola, mi nombre es Venecia, mejor conocida como Flaca. Bienvenida al sector. Vamos a darle un mini tour para que conozcan más de Villa Verde.
O sea que esta comunidad la construimos nosotros, cada quien haciendo su casita, tirando relleno, porque cuando yo llegué aquí, hace como 10 años, no se podía caminar, uno tenía que remangarse los pantalones para poder caminar.
Este sector es un sector que está muy precario en muchas cosas, de agua, de calle, de medicina, pero estamos aquí, gracias a Dios, que también otra cosa que nosotros, el agua, nosotros luchamos mucho por traer un poco de agua aquí a Villa Verde.
Ha construido el sector y hemos tratado de avanzar.
Gracias a los médicos que han venido a apoyarnos aquí en la comunidad de Villa Verde.
Esperamos recibirlo en nuestra clínica pronto.
Gracias por habernos acompañado en nuestro recorrido en nuestro Villa Verde.
Wow, big thank you to Cassandra for leading us through Villa Verde with Flaca and Pedro. It's so great to see everybody. But now we have our last song with the amazing Creole roots. So everybody get up and get dancing.
Thank you so much. Thank you for joining us, and it was a pleasure for us to be here with you tonight, and see you next time. And please don't forget to donate. Thank you so much. It was Creole Roots.
Yes, sir. Thank you, Creole Roots. Now we're going to take you to Jerusalem, Haiti. We started working there in 2010, right after the earthquake. We were doing triage in tents in the middle of the desert. Then it was a church, then temporary clinics, and now we're in the process of creating a permanent clinic. We're so happy to have Dr. Fakida St. Paul on the ground, providing support during this difficult time. She is able to see patients in the community 3 days a week. And once we can resume to full capacity, she will continue the community survey and the Women's Health Initiative. And actually, prior to COVID, she had already screened and treated, if necessary, over 200 patients for cervical cancer. That is impressive. Did you know that PPE for Haitian staff costs $500 a month? Dr. Fakida St. Paul is one of the few medical resources in the community, so please help us keep her in business. And actually, let's check in with the Haiti team really quickly. They would like to say hi and show you around.
Okay, hi. This is the front gate where the patients get into the clinic. Here, they sit and wait till we call them. They wait here till the nurse called them at the nurse station for vital signs. Right before going to the nurse station that we usually put here, they wash hands with soap and water. And the nurse station is right here. And here, this is the doctor station where they see the doctor. If we need some private consultation, some private physical examination, we come here with the patient. And if they need some lab. Before finishing, the patient has to go to the pharmacy to pick up the meds. This is here.
Thank you, Dr. Fakita, for the mini tour. As many of you know, Art for Health usually has, well, art. And in celebration of 10 years, our artists brought back some of their all-time favorite prints, available now for a limited time only, linked below. We're going to show you a behind-the-scenes look at an exclusive print made by one of our artists, Hague Williams. This piece is a limited edition handmade print in celebration of 10 years, and there are only 25 available, so click the link below to order.
Hey everyone, Hague Williams here. This year's artwork inspiration lies in the isolated palms from a larger image which I had taken while in the Dominican Republic in 2016. What a great team and what great people in the DR. The day I took the photograph of the palms was outside Parato at another site. It seemed the whole village had shown up. I loved the energy and excitement in the villages. The team showed up in the morning. It was fun to be part of something so positive and so important. Community empowerment and Art for Health has done incredible work in the last 10 years, all of it hands-on. I wanted to pay homage to that work by choosing a print process that requires a deep connection between eye and hand. Carving the image into the plate takes time and commitment. Once you have the plate carved, it requires inking the plate and pulling it through the press and repeating. The edition number for this print is 25. On my trips, I documented and helped where I could, and as the doctors and nurses worked all day seeing patients and administering much needed care and medication, I realized that community empowerment is spreading love and care. It was such a great thing to be a part of, and still is today. If you decide to purchase this print, know that it comes from that same place. Thank you for your time and energy, and here's to 10 more years of Art for Health. And you can see the results here at the end. 25 signed edition prints available to you in the store and also tonight. Again, thank you for your time.
Okay, I'm back. Hi, everybody. I hope that you've enjoyed tonight. Again, thank you to the Creole Roots for playing us out. Listen, stick around and check out the works donated by our artists, all of which are available for purchase, and you can also shop for prints on the website. The full videos will also be on the website. Guys, thank you for sticking it out with us during what we all hope to be our last virtual event, because this is kind of awkward. We hope to see you guys next year. And again, thank you so much for being here. It means everything. We cannot do this without you. We cannot do this without your guys' donations. So thank you so much. Please donate to wherever the links are. And good night. Good night.